Hello friends, today we are going to read about clinical anatomy of the medulla oblongata. So we will read from Snell's Neuroanatomy. So let's start. So what is the clinical significance of the medulla oblongata? The medulla oblongata not only contains many cranial nerve nuclei that are concerned with vital function, example regulation of heart rate and respiration, but it also serves as a conduit for the passage of ascending and descending tracts connecting the spinal cord to the higher center of the nervous system. This new tract may become involved in demyelinating disease, neoplasm, and vascular disorders. Raised pressure in posterior cranial fossa. The medulla oblongata is situated in the posterior cranial fossa lying beneath the tentorium cerebelli and above the foramen magnum. It is related anteriorly to the basal portion of the occipital bone and upper part of the odontoid process of the axis, and posteriorly to the cerebellum. In patients with tumor of the posterior cranial fossa, the intracranial pressure is raised, and the brain, that is, the cerebellum and medulla oblongata, tends to be pushed down the area of least resistance. The medulla and cerebellar tonsils herniate. Medulla and cerebellar tonsils herniate downward through the foramen magnum. This causes headache, neck stiffness, and paralysis of glossopharyngeal, vagus, accessory, and hypoglossal nerve owing to traction. In these circumstances, performing a lumbar puncture is extremely dangerous because the sudden withdrawal of cerebrospinal fluid may precipitate further herniation of the brain through the foramen magnum and sudden failure of vital function resulting from pressure and ischemia of the cranial nerve nuclei present in the medulla oblongata. So this was about raised pressure in posterior cranial fossa. What happens to medulla in raised pressure in posterior cranial fossa? Now second thing, Arnold-Chiari phenomenon. The Arnold-Chiari malformation is a congenital anomaly in which there is herniation of the tonsil of cerebellum and the medulla oblongata through the foramen magnum into the vertebral canal. This results in the blockage of exits in the roof of fourth ventricle to the CSF, causing internal hydrocephalus. It is um, it is commonly associated with the craniovertebral anomalies or various forms of spina bifida. Signs and symptoms related to pressure on the cerebellum and medulla oblongata and its involvement of the last four cranial nerves are associated with this condition. You can see here the Arnold-Chiari phenomenon. The cross section of the skull, coronal section of the skull, shows the herniation of the cerebellar tonsil and medulla oblongata through the foramen magnum into vertebral canal. So herniation of cerebellar tonsil and the medulla oblongata. This is known as Arnold-Chiari malformation. Now, about vascular disorder in of medulla oblongata. The medulla oblongata is a heterogeneous collection of nuclei and tract, and damage to different regions will elicit the following syndrome. First of all, lateral medullary syndrome of Wallenberg. The lateral part of the medulla oblongata is supplied by the posterior inferior cerebellar artery, pica, which is usually a branch of vertebral artery. So, pica is branch of vertebral artery and it supplies lateral part of medulla oblongata. Lateral part of medulla oblongata. Thrombosis of either these artery produce the following signs and symptoms: dysphagia and dysarthria due to paralysis of the ipsilateral palatal and laryngeal muscle innervated by nucleus ambiguous, analgesia and thermoanesthesia on the ipsilateral side of the face, nucleus and spinal tract of trigeminal nerve. vertigo, nausea, vomiting, and nystagmus due to vestibular nuclei. Ipsilateral Horner syndrome, descending sympathetic fiber. It is caused by damage in descending autonomic fiber. Ipsilateral cerebellar sign, gait, and limb ataxia, cerebellum or inferior cerebellar peduncle, and contralateral loss of sensation of pain and temperature. Spinal lemniscus, spinothalamic tract. So you can see the pictures of the transverse section of medulla oblongata at the level of inferior olivary nuclei, showing the extent of lesion producing lateral medullary syndrome. You can see here thrombosis. These are the areas supplied by posterior inferior cerebellar artery, pica, posterior inferior cerebellar artery in the lateral side of medulla. It will result in lateral medullary syndrome or Wallenbach syndrome Wallenbach syndrome. So in this area, what are what are the things located in this area? You can see here hypoglossus, glossal nuclei, dorsal nucleus of vagus, medial vestibular nucleus, inferior vestibular nucleus, inferior cerebellar peduncle, inferior cerebellar peduncle, mm, spinal tract of trigeminal vagus. You can see here anterior cerebellar and spinal cerebellar. These nuclei are affected, and so the symptoms corresponding to damage to this nuclei occur. For example, due to blockage, due to as if spinal tract and nucleus of trigeminal nerve is affected, then it will cause analgesia and thermoanesthesia on the ipsilateral side of the face, in the same side of the face. And if a vestibular nuclei gets affected, it will result in vertigo, nausea, vomiting, and nystagmus. If descending sympathetic fiber is affected, it will result in ipsilateral Horner syndrome. If inferior cerebellar peduncle, the if non, the due to as inferior cerebellar peduncle are also affected, it will result in uh, limb ataxia and ipsilateral cerebellar sign. It will result in ipsilateral cerebellar sign, limb ataxia, and so on. And damage to nucleus ambiguous will result in paralysis of ipsilateral palatal and laryngeal muscle. And due to paralysis of this muscle, it will result in dysphagia and dysarthria, difficulty in swallowing and speaking. So these was about lateral medullary syndrome of Wallenberg. So let's see what happens if there is what happens in medial medullary syndrome. The medial part of the medulla oblongata is supplied by the vertebral artery. Medial part of medulla oblongata is supplied by vertebral artery, but lateral was supplied by posterior inferior cerebellar artery, which is usually branch of vertebral artery. Same vertebral artery gives ultimately it is supplied by vertebral artery. Thrombosis of the medullary branch produce the following signs and symptoms: contralateral hemiparesis, pyramidal tract, contralateral impaired sensation of position and movement and tactile discrimination, medial lemniscus, ipsilateral paralysis of uh, tongue muscle with deviation to paralyzed side when tongue is protruded, hypoglossal nerve. Let's see picture. So you can see here, this blue area are supplied by vertebral artery, and thrombosis of this vertebral artery will result in medullary syndrome. And what are the symptoms? It corresponds to the uh, area area located in this area. Important um, important nucleus and tracts located in this area. So, what are the symptoms? if there is contralateral hemiparesis. Why? Because pyramidal tract is pyramid is affected. Pyramidal tract, you can see this purple color. Pyramid area is affected, so it will result in contralateral hemiparesis. And also medial lemniscus. This is medial lemniscus. If medial lemniscus is affected, it will result in impaired sensation of position. It will result in impaired sensation of position. So what we're talking about? We're talking about medial lemniscus. As a medial lemniscus is affected, it will result in impaired sensation of position and movement and tactile discrimination. And if hypoglossal nerve, this is hypoglossal nerve, due to as a hypoglossal nerve is affected, it will result in ipsilateral paralysis of tongue muscle with deviation to the paralyzed side when the tongue is protruded. If tongue is protruded, then tongue muscle will deviate to the paralyzed side when hypoglossal nerve is affected. So this was all about the clinical anatomy of the medulla oblongata. So this cross section at the level of inferior olivar nuclei is very important in recognizing medial and lateral medullary syndrome. So in next video we will talk about clinical significance of bones. So thank you.